Welcome to Washington Unplugged. I'm John Dickerson. Healthcare reform creeps ahead in the Senate, dying and coming back to life seemingly by the day. The latest reports indicate Joe Lieberman may vote for the final bill, which leaves only Democrat Ben Nelson needed to get to the magical 60 votes for passage. To give us the latest from the center of the drama, our congressional correspondent Nancy Cordes joins me. Welcome, Nancy. What's the latest?
Well, the latest, as you said, John, is that it now looks like Senator Joe Lieberman is on board as long as the bill does not contain a public option or a Medicare buy-in. And it now looks like the bill won't contain those things. So it looks like he'll probably end up on board at the end. However, Senator Nelson, he's still insisting that the bill needs stronger anti-abortion language. And so Democratic leaders are working to satisfy him, and they're working to do it quickly because time is really of the essence now if they want to pass this bill before the holidays.
One of the other things Senator Nelson and some of the other middle-of-the-road Democrats care a lot about is cost. And the CBO is coming in when with their score on this bill?
That's anybody's guess, and that's what everyone is looking for right now. It could happen later today. It could happen tomorrow. And once we see those numbers, we'll know once and for all how much some of these items cost and therefore whether they are in the bill or out of the bill. And then Senator Reid is going to have to make sure that he's got everyone on board, all 60 on board with whatever the final package is that he comes up with, and file the bill. And by our calculations, he needs to file that bill by Friday if he wants to hold a vote by December 23rd before Christmas Eve. And that is if, and it's a big if, Republicans don't employ some stalling tactics, which they very well might do.
And what kind of stalling tactics might the Republicans employ, and how effective will they be?
Well, we just saw one of those stalling tactics begin about 15 minutes ago. Senator Bernie Sanders of Vermont introduced an amendment, and Senator Tom Coburn insisted that the entire amendment be read aloud on the Senate floor. Now, that amendment is 767 pages long, so they just started reading it about 15 minutes ago, and it's going to take the entire day. So that's a day that could be spent debating, could be spent voting on amendments that now will be completely taken up by reading this bill. If things like this happen just a few more days, they will not be able to get to the final vote by the holidays.
And in theory, they could do that with continuing on with other amendments and keep going on doing that public reading. Is that right?
That's right. They have a few different opportunities at their disposal. And Senator McConnell, the Republican leader, said today that he is not interested in telegraphing his strategy ahead of time. He says he has a lot of tools in his tool belt, and he's not going to say right now whether he'll deploy them and which ones he'll deploy if he does.
Okay, last question, Nancy, is in the behind-the-scenes drama within the Democratic caucus. There's been a lot of question about the president, whether he's played enough of a role. Are his fingerprints in evidence, or his staff, in any of these behind-the-scenes negotiations with Senator Nelson or Lieberman at this point?
Not really. You know, we asked about that, whether he had really tried to put the screws to Senator Lieberman, Senator Nelson, to get them to come on board. And we didn't get much of an indication of that, not from Senators Lieberman or Nelson themselves, and certainly not from Democratic leaders. And so there is a lot of frustration, I have to tell you, John, among liberals, both in the Senate and in the House. Liberals who say the president could have exerted so much more leadership in this fight. He could have pushed harder for the public option and some other liberal priorities, but he just didn't. He never made it make or break for some of these senators, and that's why they felt more comfortable stepping out on a limb and saying, no, I want to put the brakes on this, I want to oppose it. They didn't feel like there would be any repercussions for that. And so there is a lot of anger today among liberals in the Senate and in the House.
Okay, Nancy Cordes from Congress, thanks very much. Enjoy the reading of the Sanders bill today.
Thank you so much.
The Senate debate is just one act in this multi-part drama. Next up, the conference committee, where the president and Democratic leaders will try to blend the Senate bill with the very different House version. This may be like getting dogs to snuggle with cats and may have long-term implications for the 2010 election. CBS News pollster Sarah Dutton and Marc Ambinder join me to discuss. Sarah, I want to start with you. Set the landscape for me here in terms of this bill and the public's feeling about health care reform.
You know, it's been a bit of a tough sell in the polling we've conducted on the subject this year. We found that Americans are very, very, very concerned about the cost of all of this. While they certainly think that health care needs major overhaul, they are worried about the cost, especially on the heels of the stimulus package and some of the bailout bills. So in the first place, there's concern about cost. But secondly, Americans really aren't convinced that this bill is going to help them. In our most recent poll, only 16% felt that these health care reforms reforms would help them. Twice as many, 34%, felt that they would hurt them, and just over 4 in 10 felt that they would have no impact on their lives. So we're not seeing a lot of motivation for Americans to get behind this, other than just a general feeling that people who don't have access to insurance should have it.
Marc, I want to ask you about the point Nancy made, which is that these liberals are angry at the president for not stepping in, not doing enough. When these two bills are melded, this is when the president is supposedly going to come on stage. And if he does so, it's likely to make a bill that those liberals are not likely to be happy with, isn't it? It won't have a public option. It might have abortion language they don't like. How do you interpret this anger from the left at the president?
Well, I think the anger from the left can be seen in this formulation. One reason why the health care bill is so unpopular with the American people is because it's been associated with Congress, which is so unpopular with the American people. And ironically, the president's poll numbers have been dropping over the past 6 weeks because of his association with a health care bill that he hasn't embraced. I think there's a sense among liberals that, not necessarily that if the president had, it's interesting, I think the anger among liberals is directed mostly at Congress, particularly at the majority leader, Harry Reid, for allowing Senator Max Baucus to essentially put forward the draft that served as the blueprint for everything, and for allowing individual senators like Joe Lieberman to hold hostage elements of the bill which liberals believe would be a precursor to a dramatic change in the healthcare system. I think quite honestly, liberals invested so much in the idea of the public option transferred to this Medicare buy-in example that its absence for them is in many ways like a Waterloo. But they're blinding themselves to the idea that, and this is what the president continually does say, is that what this bill does is lay the foundation for dramatic expansions of coverage later. It's not something that liberals will accept.
Sarah, let me ask you about the public option. Liberals are obviously quite exercised about it, but what's the more general view about whether this is crucial to health care reform?
It's interesting, the debate in Congress over this subject, because it's something that Americans have supported. A majority of Americans have supported very consistently since we first began polling about it early summer. About 6 in 10 Americans in every poll we've done have felt that health care reform should include a public option, which would be a government health insurance policy similar to Medicare. So it's really not something that's been controversial, nor has it been subject to being influenced by the debate in Washington. Americans are very, very consistent in their support for it.
Marc, when we get into conference committee, the argument from a lot of smart people and a lot of people in the White House is basically Democrats have to pass something. That it would just be so catastrophic to not pass something in 2010 that something's going to pass. Do you buy that? Is that still the way things are?
I actually buy that, and I think the proof in the pudding is the fact that you haven't yet heard of any serious defections among House liberals. There's a lot of agita. There's, Roland Burris in the Senate saying he's going to vote against the final bill, which is fine because the final bill you need 50 votes, not 60. You just need 60 to avoid the filibuster initially. So I think the message is getting through to enough Democrats, and I actually think the conference is going to be less acrimonious and might actually, in the end, result in some minor victories for progressives, more so than people think, in part because the president has said he's going to exercise his leadership, and he does have a very definite direction in which he wants to go.
All right, I want to pivot now to the last question here to you, Sarah, and that is, the president's approval ratings have been going down. What happens if this passes? Where is he now? And should we see this adding a great deal to his approval ratings? Because, of course, those approval ratings will give us some indication as to whether he can politically help all of those members of Congress who are up for election in 2010.
Sure. In our latest poll, his approval rating was down to 50%, which is the lowest that our poll has measured yet since he took office. That's down from a high of 68% back in April, around the time of his 100 days. So he's had quite a drop. But, to put it in a little bit of context, plenty of other recent modern presidents have dropped down to about that level during their first year in office as well. George W. Bush was at 50% in August of 2001, just before the attacks of 9/11, which of of course, propelled his approval rating into the stratosphere, but he was at 50% just before that. Bill Clinton was around that level as early as May of his first term. Ronald Reagan hit a number like that after about a year in office, and Jimmy Carter as well. So, you know, seeing a slide in approval ratings is not unusual during a president's first term. That said, this president is dealing with a number of very serious issues, both at home and abroad. There's the war in Afghanistan, of course, his increase in troops over there. We need to see how that goes. That is a war that Americans think is going badly, and they have for quite a few months. And his approval rating on that is below 50%. But most troubling is the economy. And our polls show 3/4 of Americans say the economy is in bad shape. It is by far the #1 problem that Americans want to see addressed. In our last poll, 47% said that that was the most important problem facing the country. Healthcare came in second, mentioned by only 12%. So there's a huge gap between Americans prioritizing the economy and healthcare. And in our last poll, President Obama's approval rating on handling the economy was the lowest we'd measure yet. It was at about 47%. So I think that's a real area of concern. You know, our last poll also showed 50% of Americans disapproving of how the president was handling health care. So perhaps he can get that number down, his approval rating up on that. But I think in terms of his overall approval level, we need to probably see some improvement in the economy, some decrease in the unemployment rate, some perception among Americans that the economy is getting better and that companies are hiring again before we see his overall approval level start to rise.
Let me ask Marc about that. On the question of the economy, if the president passes health care reform, how many voters is that going to get on the streets? And could it be that he's passing something that doesn't do very much at all to deal with the key concern that people have and that may determine the 2010 election?
I think his approval rating isn't really going to be affected in the near term by passage of health care, because with independents, the main concern is the economy. With liberals in the Democratic base, it's that his policies aren't progressive enough, and passing health care doesn't really do anything to address either of those concerns. In a sense, the White House is going to have to do, reminds me of that movie Dave, where the accountant talks about a government program to sell the American people on something that they've already bought. The White House is going to have to aggressively sell this to the American people if they want to make if they want to get a political gain out of this. I think what you're going to see the White House do in 2010 is focus on ways of re-enthusiasing, that's not a word, but
you can mint it here today.
I'm minting the word because he needs to kindle enthusiasm among the Democratic base. I think he's going to do that, try to do that with immigration reform, by selling financial reform aggressively, perhaps don't ask, don't tell, card check. There's a list of things he can do to kind of kindle that fire. I don't think healthcare is going to do it for them.
Very briefly, so that would be doing it with sort of honey, giving the liberals what they want.
And he hasn't given them very much honey this year, so.
Is the alternative that, though, to just beat the dickens out of the Republicans? Because some of those things you mentioned are going to be tough to pass. The president does have the bully pulpit. If he beats up on Republicans, it could get Democrats out. Of course, that would be very different from the man who ran in 2008.
The White House believes that every time the president is seen as reaching out to Republicans and Republicans bat him down, which has been the pattern for the year, it helps them. So I don't think the White House, I think the White House is going to do that. And I think they're going to leave it to congressional Democrats to constantly beat on Republicans.
Okay, thanks, Marc Ambinder, Sarah Dutton, thanks very much. That's it for Washington Unplugged today. Thanks all of you for watching. Find us here every day at cbsnews.com at 12:30 p.m. I'm John Dickerson. Have a good Wednesday.